So I guess a question, I mean, obviously, there's a lot of players involved in telemedicine and telehealth, right? So there's the service providers, right? So people can buy broadband services. There's the hospitals and doctors. And then even, further back behind the scenes, right? There's the people like us that, develop networks and deploy networks and have software to help create networks. At what point, I guess, I guess let's maybe start on the service provider side, you know, do you help encourage use of, one more application of why having broadband is important? Like, do service providers need to get more involved in the promotion of this new application? Again, I know it was around before COVID, but even like, is it something that we should all be promoting?
Well, I guess where does it fall, right? Is it federal? Is it nonprofit? Is it, the private sector? I mean, when we think about education, I'm really curious to get the team's thoughts on it, because we clearly have seen, to Rachel's point, a huge uptick in use, right? You've almost been forced to use, and thank goodness there's been this option for many. It's clearly probably helped flatten this curve, but how do we get the word out? What is the right means, right? Because there's capabilities out there today. I mean, Rachel, I went to your Prime Health Summit, and they awarded tons of money to all these amazing innovators doing all kinds of remote healthcare. And the whole time, as a broadband guy, I'm thinking, that's awesome if you have connectivity. And there were so many amazing innovations, but what is the means of education, do you think?
So emphatically, yes. I think that as much as possible, any industry that relies on broadband, or any sector that relies on broadband connectivity, which is, so I guess to back up for a second, access to the internet and good internet has really become, I think, a basic human right and something that should be a public utility. Whether or not you have access to adequate internet influences your access to education, healthcare, economic opportunity, the quality of those resources, your overall public safety in your community, right? Whether or not your fire department and police officers and people like that have the connectivity that they need. And so it's interesting, Brian, and we've talked about this before, that we see quite a lot of advocacy in the healthcare space for broadband, that our hospitals need broadband or need internet connectivity. I've had, we were talking about mental health, and I did a program where we brought free telepsychiatry, live video, and consults and all these other things to rural hospitals to address these significant behavioral health shortages in our state. And one of the hospitals, I was like, I've got this virtual mental health practice. We'll give you everything you need. See your patients completely free, support you however you want, unlimited, all of that. Like, it was a program that I was doing that was paid for by the state, so it was fine. And we had a hospital CEO that burst into tears in a meeting because they were having such out of control issues with behavioral health and substance use and all of these needs. The nearest mental health clinic was 4 hours away. And they really needed this service, but they couldn't use it because they could only check their email once a week, apparently, when like some sort of satellite went over them or something. Like, they were having such bad, I wish you would know more about, I don't know if that's technically accurate, but it was basically like there were only 1 or 2 times a week where they could even check an email. So even trying to Google something, or look something up or verify the dosage for a medication and things like that was hard to do. Same with education in any other space. But I don't see a ton of coordinated effort or coordinated advocacy in the community. I see advocacy in education, advocacy in healthcare, advocacy in economic development. We see initiatives like smart cities. We see and then we have Office of Broadband, Office of IT, Office of eHealth Innovation. We have all of these different people that are working on it, as well as foundations that fund it through a lens of healthcare or through a lens of something else. And so Yeah, that touches a nerve for me, and that this is something that everybody can agree we need. And that is one of the biggest influencing factors today in our society as to what your quality of life is going to be in your community. And it's also, on the positive side, a really powerful revitalization tool for rural communities and small towns and things like that, to be able to continue to do that. And also, if you think about it, as a way to address the housing crisis. So yeah, I think broadband should be important to everybody, and that we should do more to advocate for that in our communities.
There's
So
nothing like
that's a lot to unpack.
Started.
Sorry, Sue, go ahead.
there's nothing like losing money for people to pay attention. And I couldn't agree more. I think healthcare, education, energy, work, everybody's suffering from the same thing, which is how do we provide our services? I think of this like a bridge. I mean, they build bridges differently now, but it used to be, they start building on one side and then they start building on the other side and then they meet, right? So healthcare and education, they're scrambling to figure out how to provide what they do normally in a virtual world. Okay, workers, employers, same thing. But on the community side, on the consumer side, children, people, families, who's paying attention to that digital equity? Who's paying attention to the last mile? Who's paying attention to digital inclusion? People can't afford the connectivity. They don't have the devices. They don't know how to use them. So it seems to me that Rachel, what you've been talking about is a perfect opportunity to start aligning across these ecosystems for the same exact thing, which is to really start empowering our communities and creating those public-private partnerships to do what needs to get done. Because, I mean, healthcare is not going to support the people in their homes. They're not going to do it. Education's not going to do it either. And it's really behooves the communities, the local governments, the state governments, the federal governments, the private sector to come together and figure out how to do that digital inclusion piece.